Institute of Urology, Dhule, India presents Hero's Magic Fountain Principle for Fragment Evacuation after Pulverization of Bladder Calculi. Use in the first 10 cases. The objective was to invent a novel technique for fragment evacuation after endoscopic pulverization of large bladder calculi. The methods included: Number 1. Development of the fountain technique. Number 2. Selection of bladder calculi more than 4 cm in diameter. Number 3. Use of the fountain technique. And number 4. Evaluation of this technique. What is the fountain technique? The fountain technique is based on Hero's principle of the magic fountain. This principle defines the flow of water from a point of high pressure to the point of low pressure. The bladder is used as a closed cavity with 2 openings. Normal saline is flushed in through one opening and all the stool fragments are flushed out through the other. Steps of the procedure include a cystoscopy, which is followed by a cystoscopy-guided suprapubic tract establishment. Cystolitholepexy is completed, and then the fountain technique is used to evacuate the fragments. For the fountain technique, the following equipment is used: a 30 French suprapubic Amplats sheath, a 22 or 25 French perurethral cystoscopy sheath, and an evacuator like the Eurovac system to push normal saline into the bladder. The cystoscopy sheath is placed perurethrally while the Amplats sheath is placed through the suprapubic tract. Saline is flushed using the evacuator through the cystoscope sheath and the stone fragments retrieved through the suprapubic sheath. Irrigation fluid can be attached to the cystoscopy sheath to allow normal saline to flow in during the flush. This helps to have continuous cycles of the fountain technique. We use the technique in 10 patients with age ranging from 30 to 66 years. 2 had history of previous open bladder surgeries and 3 underwent concomitant TURPs. The average stone diameter was 55.2 millimeters and the stone weight 281.9 grams. The average time required to evacuate the fragments by the fountain technique was 15.31 minutes. The residual fragments were extracted by forceps, which required an average of 11.7 minutes. Out of the average 30.3 cycles used per case, only 5 cycles were futile. This was attributed to fragment impaction in the Amplats sheath and occasional blind intravesical positioning. An average of 16.7 fragments could be retrieved per cycle. Thus, 1 fragment could be retrieved by the fountain technique on an average of 2.08 seconds. There were no complications associated with the fountain technique, and at no time did we have to abandon the technique and convert to the conventional methods. We thus conclude that the fountain technique is safe, fast, effective, and easy to learn.